Hello, I am Tu Kim Lam. Welcome to the Medical News Show. In this edition of the Medical News, we will give an update on radiology to use for diagnosis and treatment. Here with us today again is Dr. Tran, who is currently practicing internal medicine in Thuat Chup, Virginia. He will give us the information on this topic. Please join me to welcome Dr. Tran to the Medical News.
Hello and welcome to our show today. And again, hello Mrs. Lam.
Dr. Tran, today we're going to talk about radiology. Radiology has been used in medicine for many decades. Can you tell us when it was first introduced into medicine?
It's very important because I think the story of the radiology that we use nowadays, I think we owe to the founder of the radiologies. His name is Roentgen. He's a German physicist. He's the one who discovered the X-ray in 1885. And in 1901, he's received the Nobel Prize in medicine for his discovery in X-rays. And since then, really, the X-ray were applied all over the world to help to make the diagnosis of the inside the body, like bone, lungs, and abdomen. But the limitation of X-rays that bring most of the scientists try to figure out how to get deeper into the body. And in 1956, the ultrasound was first used in Poland. Since then, the ultrasound is spreading all over the world because right now we have ultrasound in every nation and every hospital in the world right now. But the most breakthrough in medicine in radiology is in 1972, when the CAT scan was invented by an English engineer. His name is Gottfried Hausfeld. He's the one really putting together about the knowledge of the CAT scan. We call it compute axial tomography. He using the knowledge in computer as along with the other method to using the compute axial tomography to invent the new really breakthrough in radiology. Because CAT scan we're using nowadays mostly everywhere in the world. But until 1977, one of the other breakthrough in radiology is the MRI, that we usually call MRI. The magnetic resonance imaging is going to replace the CAT scan in most of the field that we don't need to or we're afraid of using radiation. Nowadays, we're talking more about PET scan, the positron emission tomography, because the ultrasound, the CAT scan, the MRI cannot give exactly the activities of different organs in the body. The PET scan answers that question to really give us some idea about the activity inside the body by using the different radioactive substance and spatial scanner and to receive the signal from different organs. Now we're talking about nuclear medicine, and the intervention radiology is the most popular and the most minimally invasive procedures now using around the country. And we ought to talk about that later in this program. They call intervention radiology.
Dr. Tran, according to the history you just gave it to us, X-ray is one of the forms using radiology. Can you explain it to us how X-ray is used?
Since the time discovered by Roentgen, the X-ray is still using nowadays. Not much changing, but it's the oldest procedure that we use to take the pictures of especially the lung, the bone, and the skull. Now, the X-ray cannot give more information than that, and mostly because the X-ray can give the maximum of the images through the X-rays only. Still using to detect abnormalities, the lung, like TB, pneumonia, or any fractures with the bone or fracture of the skull. But the X-ray cannot give information about the brain inside the skull. Very cheap, not expensive, very useful in common procedures. And really, the patient only receive a minimum amount of radiation only. So therefore, the X-ray is still able to use nowadays by most of the hospital, most of the doctor office, and it's still able to use that. If you look at the X-ray and the pictures on the screen, you can see the simple position on the right side, the X-ray machine. And most of the time, the patient has stand up, the face against the screen, and then the X-ray put behind the patient to take the picture. And if you can see the X-ray of the chest, it looks like the middle is the heart and both sides is the pictures of the lung. And then you can see the pictures of the X-ray, regular X-ray of the bone of the hand. And then lastly, the X-ray of the skull. So that's just the most area that the X-ray can provide information for us.
Dr. Tran, after the invention of X-ray, here come ultrasound or sonogram. What are the differences between ultrasound, sonogram, and the X-ray?
The ultrasound is different because the ultrasound doesn't use the radiation. And then we use different form of the ultrasound. This means the wave of the sound. And the machine will really send a signal by using the sound, go deep into the body and go to different layers of the body from fat, muscles, and go to the organs in the body. And then the machine will receive the reflection of these waves back to the machine, and the computer will analyze the information and give us the pictures of the sonogram. It's still very cheap, not expensive. The most benefit of ultrasound is because it doesn't use radiation. So we use mostly ultrasound to detect the structures of the baby in the pregnant woman, or detect the abnormality of all the vessels in the body, like detect the blood clots in the vessel. Especially the ultrasound can give some information about the activity inside the heart. And in that case, we call echocardiogram. Instead of using ultrasound of the heart, we use the term in medical term echocardiogram. This means using ultrasound to get the picture inside the activity of the heart. Now, look at the screen, you can see how simple the sonogram machine. Right now with the technology nowadays, you can see the ultrasound sometimes small like the iPhone or the iPad, and the physician can carry with them everywhere. The 911 staff can carry a tiny little ultrasound with them as well. So therefore, the ultrasound right now is the most popular form of X-ray, has been using everywhere in the world, especially including Vietnam. Most of the hospitals, small hospitals in Vietnam, also able to provide some kind of ultrasound X-ray for people in these hospitals. Now, I just give you some idea about ultrasound. If you look at the X-ray of the ultrasound of the baby, you can see right in the middle of the screen is the baby by using 2D ultrasound. 2D means two-dimensional ultrasound. Now, you cannot see the pictures very well, but if you go to the next one, you can see the 3D ultrasound picture. You can see clearly the face of the baby and able to differentiate between the boy and the girl early, especially about 6 months up. Yeah, the radiologist can give the mother some idea about whether the baby will be a boy or the girl. That's the benefit and the beauty of the 3D ultrasound.
Dr. Tran, when do you send the patient to take X-ray, and when you send them to take the ultrasound?
Really, the ultrasound doesn't use the radiation. So anytime that we try to avoid the radiation, we use ultrasound. But the ultrasound has some limitation as well, because ultrasound, in case of the people with the large amount of fat, like obese, we cannot get the good pictures. Especially the ultrasound cannot go deep into the brain and cannot go through the bone to give the picture inside the brain. And also ultrasound cannot give information too much about the lung as well. And for the organ in the abdomen, the ultrasound can give more pictures of the liver, the gallbladder, but the rest of the intestine, the ultrasound cannot give information. So therefore, some limitation using of the ultrasound. And the rest is for the bone, we use the regular X-ray. For the chest, we use the regular X-ray. X-ray is really sufficient to give information about these organs.
Dr. Tran, after the sonogram ultrasound, CAT scan become very popular, and even many patients request the physician to send them for CAT scan. Can you tell us about CAT scan, and when do you send a patient for CAT scan?
CAT scan is one of the breakthroughs in radiology. The real name of the CAT scan is compute axial tomography. Tomography, axial means they will put the patient into the big tube, and the radiation will move around the body and cut the body into slide. For instance, like we try to cut fish, we try to slice into small pieces before we cook. The same thing with the machine. They will cut the body in slide in different layers. So therefore, the radiologists, when they read, they have to read in different steps and go through all the steps of the body. For instance, like from the abdomen, they have to go through from the top of the abdomen down to the pelvis area. So we have to underline different information. So that's all the things about a CAT scan. Very important because the CAT scan, really, if you look at the pictures on the screen, you can see it's a big tube and the whole body will get inside the tube. And then the pictures of the CAT scan, you can see is the cut. And you see on the screen that's the pictures, the CAT scan of the lung. And the right middle is the vessels, the heart, and both sides is the lung on the right side and the left side. And on bottom of the screen, you can see that's the vertebrae of the vertebra. And then this is pictures of the CAT scan of the abdomen. You can see on the left side the big organ is the liver, and the right side is some of the picture of the stomach, and the rest is some of the organ in the abdomen. So these are the classical pictures of the CAT scan of the body.
Dr. Tran, can you explain the differences between CAT scan and sonogram?
The CAT scan really gives more information in any organs. They give really precise the pictures and different from the ultrasound. They can give the pictures of the brain. They can give more pictures of the neck, the chest, and including everything is in the abdomen, including the uterus and the bladder, etc. So therefore, the CAT scan is much more advanced than the ultrasound. But the problem is because the patient will be exposed to a lot to radiation, because with the CAT scan, we have to use a lot of radiation to get the good pictures of the body. The patient has to be in the machine a longer time than the regular X-ray.
Dr. Tran, some patients when they were sent for CAT scan, they were asked to take a contrast dye. Can you explain what is the contrast dye, and does the contrast dyes have any side effect when the patient take it in?
Contrast dye usually is can be given to differentiate between what belongs to the artery and vessels and what really not belong to the vessel. The contrast will be injected intravenously, and the contrast will go to the organ, go through the vessel system to the venous system, and it will appear on the screen with the picture being intensified in density. So the radiologist will be able to differentiate between what belongs to the vessels and what really not belong to. Very important, because sometimes it's difficult for the physician to differentiate what really inside the body, especially in one organ. So I think it's contrast is they have the adverse effect is because sometimes causing allergic reaction, or if you use a lot of contrast, may affect the kidney as well. So therefore, contrast only indicated when the physician feel like they need to use that to help to make the diagnosis correctly.
Dr. Tran, another procedure that's using radiology is MRI, and it does look similar to CAT scan. So can you explain what are the benefits of the MRI?
The difference of MRI because it's newer, and the fact is they don't really use the radiation like the CAT scan, but they use different principles of the body related to the proton. The MRI means the magnetic resonance imaging, because in the body, most of the time, most of the organ is composed of the water. And in the water, the key element of the water is proton. So when we put the patient into the big magnetic field, the proton will be rearranged based on the density or depend on the levels of the water in that organ. So with that pictures, the computer will analyze the information and give us exactly what really the organ look like on the MRI. The benefit of the MRI is just it's not using radiation. So people are able to expose to that, able to have multiple MRI as well, without afraid of being exposed to a lot of radiation like CAT scan.
So, Dr. Tran, when do you send the patient for CAT scan and when do you send the patient for the MRI?
That's a very important question because most of the time the physician will have to decide whether they will rely on MRI or they will use the CAT scan. The MRI is able to give much better pictures in clear and detail, especially in the tendon, muscles, the joint like knee, and especially the brain, and sometimes using for better pictures of the liver as well. Now, the CAT scan also can give the same information, but it's much less detailed than the MRI, especially when dealing with the muscle and joint, then the MRI much better. The only problem with the MRI is because MRI cannot be used all the time when the patient really have the pacemaker or any metals in their body or any artificial organ placement like knee replacement, the prosthesis, or anything related to metals in the body. The MRI cannot use it because they have to use the big magnetic field. Therefore, in these cases, we have to rely on CAT scan. The problem with CAT scan is the CAT scan is much more problem with radiation than MRI. So to compare the two, I think MRI is a little bit more superior than CAT scan, but it has some limitation because we cannot use all the time. The CAT scan cheaper, available all the time, much faster because MRI take longer time to get the picture, but CAT scan always available in any hospital, and they can do it much faster and quicker, and they can give the information much more faster than the MRI.
Dr. Tran, we talk about the sonogram 3D, we talk about MRI, we talk about CAT scan. So let's talk about PET scan. How's the PET scan used that different from MRI or CAT scan?
The PET scan is different things in radiology because PET scan stands for positron emission tomography. Remember, we have the X-ray, we have the ultrasound, we have the CAT scan, the more advanced is MRI. But really these procedures can only give the pictures of the organ only. They cannot tell. They cannot give the activity of these organs in the body. The PET scan answer that question because they rely on the activities of different organs. Why is that? Because the principle of the PET scan is to try to introduce to the body the amount of the radioactive substance. And then when they go into the body, they will send the signal or emit the signal. That's why they call emission. The emission will be received by the scanner put outside the body. The receiver will receive and will be analyzed by the computer and give the pictures of the real activity of the organ. So that's the benefit of the PET scan. Now, how we do introduce the radioactive into the body? We have really the radiology, we use the special substance called FDG glucose. This is regular sugar, but we can inject into the body without any harm. And the glucose will move all around the body, and everywhere the cell in the body will pick up the glucose for their own use because that's the source of energy. When you do that, then the more activity of that organ, the more they will pick up more uptake from radioactive. And therefore, we can analyze information. We know exactly where they get the most activity in the organ. And with that information, a radiologist can really differentiate between the benign tumor and the cancer tumor. Because the cancer will pick up more activities, pick up more radioactive. glucose. The benign, they don't need that. They can really quiet, they silent, so therefore they don't have any more activity. With that, I think we can give some information more about activity of the tumor, and that's the only way we can figure out whether the tumor is really cancer or not. Especially very important to follow the people who are having cancer, and under treatment or after surgery, they use the PET scan to follow up these patients to detect to see whether they have metastasis, meaning the cancer moving everywhere else in the body.
So for the CAT scan, they have to take the contrast dye to see the differences with different organ and the blood vessel. For the PET scan, they got insert with the sugar fluid into the system. That's the differences between CAT scan and PET scan. How can you tell the difference if a patient has cancer or without cancer?
Yeah, that's the PET scan is really the machine exactly like CAT scan. Only the substance we use to give in intravenously. If you see the pictures, you can see a little bit different because on the screen you can see on the left side that the real pictures of the regular CAT scan is just black and white. The middles is the pictures of the body is ready to receive the glucose with the radioactive substance. And the third one is on the right side is with the color, the red color with different levels of density. And then the darker the color, the more activities of that area. So if we can use that, then we can differentiate between the regular area with tumor, cancer, and the area without cancer. That's the pictures of the PET scan. When we inject the radioactive glucose in the body, the cancer will pick up more signal. So when we analyze information, if the tumor really pick up more activity, that means they're still active. And most likely that's the cancer. Or they have something going on, could be just infection. The benign tumor doesn't pick up anything. A scar in the body cannot pick up anything. So the PET scan give more activity of the system of the body for us to analyze information.
Dr. Tran, new procedures called intervention radiology has become very popular nowadays in medicine. Can you explain it to us what intervention radiology is?
Well, intervention radiology is the very new subspecialty in radiology. I mean, radiology in general have many subspecialty, but intervention radiology is one of the most advanced and the most popular specialty in radiology. Why is that? Because right now we use a lot of intervention, try to avoid surgery if needed, to detect any cancers and detect any tumor of the body without relying on surgery. The story starting long times ago, back in 1969, when the catheter was used and also introduced the stent to introduce inside the catheter to put into the body. The catheter is made as very tiny, small tube that we insert into the vessel in the body. And later, that concept was using first time and to open up the blockage artery in the heart called angioplasty. By introducing the catheter inside and put the stent to balloon and open up the narrowing of the artery. Since then, the intervention radiology has spreading and really progressed rapidly into different level. And right now, with the technology, they can go into the brain to open up the blockage in the brain. They go into the liver to treat the cancer of the liver. They can go to uterus to try to really block the development of the fibroid in the uterus. And also, therefore, the intervention radiology is very good in terms of provide more treatment methods and procedures and for the patient and as well as for the physician.
Dr. Tran, so how does intervention radiology is used in making a diagnosis of a disease?
The main roles of the intervention radiology is try to make the diagnosis of any tumor of the body. Right now we have ultrasound guided biopsy. Means is we try to locate different abnormalities in different organs and try to use ultrasound to guide the needle to put into the area, get some kind of specimen for testing. Right now, most of the time we able to avoid surgery because before the technology, before the intervention radiology, most of the time we have to do surgery to do the biopsy of the organ. And then later we can see is the CAT scan guided biopsy, also the same principle. You CAT scan to guide needle exactly where we can get into the body to just to remove a small piece of specimen and tissue for analysis and for pathology. If you look at the pictures on the screen, you can see the ultrasound of the breast, and with the high bone density right in the middle, that's the area suspecting the cancer. And with the ultrasound, it can guide the needle into that area and really able to really remove some of the specimen for testing. The second picture you can see is the CAT scan of the chest, right in the middle is in the heart, and the right side you can see a small density is white. That's the area suspecting cancer, and we see able to use the CAT scan to guide the needle to that area to pick up the specimen for biopsy. So this is the benefit of the ultrasound and CAT scan guided, because we most of the time we can avoid surgery and use the technique to obtain the specimen for testing. It's very important.
Dr. Tran, you said that besides making a diagnosis of a disease, it's also treat a disease. Can you explain how the intervention radiology used for treatment?
The best right now of intervention radiology, because right now we use the idea, and after we carefully study the development and of the tumor, we know that any cancer usually surrounding by a lot of vessels, because they need nutrition, they need oxygen, they need blood flow in order to really sustain or growth. So therefore, we know that. And the only thing we can treat these cancers is try to stop that process. I mean, stop the supply of the energy and supply of blood to the tumor, and stop the nutrient. So with that principle, right now with intervention radiology, we can approach the tumor closely to these vessels and try to block all the vessels and try to introduce the chemo substance to destroy and provide the radioactive chemicals and substance, and to help to destroy the cancer cell as well. So right now with the technology, right now we use these very small ball called microsphere and try to block on the activity of the vessels surrounding the tumor.
You mentioned that intervention radiology is used to treat cancer. So that including liver cancer, right, sir?
Yes.
Can you explain clearly and in detail how the treatment is applied into liver cancer?
The principle applied to the tumor of the liver, because any tumor liver usually have a lot of vessels in there. So the only way is I can introduce to you a short movie. You can see on the screen, this is the models of the patient. And the right side, the abdomen, you can see the liver, and inside the liver you have the tumor. Now, if you look carefully, you can see the tumor is surrounding by a lot of artery or vessels because it provides nutrient. How to approach and how to get closer to the tumor? We have to use a small catheter, insert into the vein in the groin area, and advances until get closer to the liver and get closer to the tumor. And now you can see on the pictures, there's so many vessels surrounding tumor, the cancer. And now we release these microsphere, this very tiny little ball, carry radioactive iodide treatment, and also carry the chemo substance as well. With that, you can see the radioactive, the chemo substance will destroy the cancer cell and make it shrink, and then just go to necrosis, it's been completely, not active anymore. Now, after that, we have another new technology that we can inject the chemical to stop the process of produce more vessels for the tumor to use. The cancer cell have the characteristic is they release some chemical to attract and produce and making more vessel for them to use. So right now with the chemical, we stop that as well. So right now with the tumor, especially tumor of the liver, very successful is applied to treat the tumor. If the patient cannot really go to surgery or waiting for the transplant of the liver, Nowadays, most intervention radiologists, we use this technique to call chemoembolization. Chemoembolization is the term using to describe how we can treat the tumor or the cancer of the liver by using technology in intervention radiology.
Dr. Tran, before we close the show, can you give us some thoughts on the far advanced technology on radiology nowadays?
I know the technologies go fast, and I'm afraid that I hope you can follow me and on kind of technology we use in medicine. But I think it's intervention radiology, the futures of the radiology, because besides making diagnosis, making the correct diagnosis and precisely with the ultrasound and CAT scan guided, now we use this technology to treat different tumors of the organ. So hopefully with advancement of the medicine, we can use more the technology and to treat the all kind of disease in the body by using the knowledge in radiology.
Thank you, Dr. Tran. That is all the time we have for our Medical News Show. Thank you for joining us, sir.
Thank you again for watching our information today, and hopefully we can provide you with some information that really very important for the daily lives, and understand the medical term that usually most of the physicians using, because that's the most difficult part for the patient. They don't understand what the patient talking about, and we have that idea when you go through these information. Hopefully you can get some basic understanding when you have to sit down and discuss with different group of physicians, try to solve your own problem or your family problem or any future problems may arise in your life.
Thank you, Dr. Tran. That was Dr. Sang Tran, who just shared with us the information on the update news on radiology and advanced technique to treat cancer. That is all the time we have for our Medical News Show today. Thanks for watching. I am Thuat Kim Lam. We see you next time on the Medical News.